Hey everyone, and welcome to another deep dive. Today we're diving into the world of composite dental bonding.
Ooh, that's a good one.
It is, and I was looking through the research that you sent me, and it's amazing how much you can change about your smile with this procedure. It's like getting a little artistic touch-up for your teeth, but it's not just about looks, from what I see.
No, not at all. What I find fascinating about composite bonding is that it can address both cosmetic and functional issues.
Oh, wow.
So you're talking about fixing chips or closing gaps, maybe even reshaping teeth to improve your bite.
Right.
And, you know, it's surprisingly quick compared to some of the alternatives out there.
So for anyone out there like me who hasn't spent much time in a dentist's chair lately,
Sure.
can you break down exactly what composite bonding is? What are they actually doing to your teeth?
Okay, think of it like sculpting,
Okay.
but on a tiny scale.
Uh-huh.
The dentist uses a tooth-colored resin.
Okay.
It's this special composite material, and it comes in a variety of shades to match your natural teeth.
Oh, wow.
They apply it to your tooth, they shape it, and then harden it with a special UV light.
Huh.
It's almost like building up a tooth with these tiny layers of clay
Yeah.
and then magically solidifying it.
Wow. So wait, different types of resin?
Yeah,
Is there like a best kind?
that's a great question. There are actually different types of composite resins, each with their own pros and cons.
Oh, really?
Yeah, like there's microfilled composites, which are great for polishing to a high shine.
Uh-huh.
And then there are nano-filled composites that are known for their strength and durability.
Wow.
So the dentist chooses the right type of resin based on the specific needs of the case.
That makes sense.
So if you're looking for a really smooth, polished finish, they might opt for the microfilled composite.
Interesting. I never knew there were so many options.
Yeah.
Okay, so let's walk through the actual procedure.
Okay.
What can someone expect when they go in for composite bonding?
Well, the first step is matching the shade of the resin to your existing teeth.
Oh, okay, so they get that just right.
You want a seamless blend, right?
Yeah.
The dentist will prep the tooth surface,
Okay.
kind of like roughing it up a bit, so that the
Oh,
bonding material can adhere to it.
I see.
They apply a conditioning liquid. It's like a primer for your teeth,
Yeah.
and this helps create a strong bond.
Okay, so it's not just slapping on the resin and calling it a day.
No.
There's actual prep work involved.
Precisely. It's all about making sure there's a really secure and lasting bond.
Okay.
After the prep, they'll apply the composite resin in these thin layers, shaping it as they go to get that desired result.
Huh, interesting.
Each layer is hardened with a curing light.
Okay.
It's a special type of UV light that activates a chemical reaction in the resin,
Right.
causing it to solidify.
That's so cool. It's like building up the tooth layer by layer. It's almost like 3D printing with light instead of plastic.
That's a great analogy.
Yeah.
And after they've built up the shape, they polish and refine it until it blends seamlessly with your natural teeth.
And how long does this whole process take? I'm imagining hours in the dentist chair.
Not at all.
Oh, okay, good.
One of the big advantages of composite bonding is its efficiency.
Okay.
The whole thing usually takes about 30 to 60 minutes per tooth.
Wow, that's much faster than I expected.
Yeah,
So you're in and out relatively quickly with a brand new smile.
exactly. And the recovery time is minimal.
Oh, that's
You
nice.
can pretty much go back to your normal routine right away, with a few precautions, of course.
Okay, precautions noted. So far, this is sounding pretty amazing.
Yeah.
But I know there are always two sides to every coin, right?
Yeah.
What are some potential drawbacks or limitations of composite bonding?
Okay.
What's the catch?
You're right. No dental procedure is a perfect solution.
Right.
One thing to consider is that while it is durable, it isn't as strong as veneers or crowns.
Okay.
It's also slightly more prone to staining than natural teeth.
Oh, really?
So you might need to be a bit more mindful of what you eat and drink.
Makes sense.
And you'll likely need touch-ups or replacements down the line.
Okay, so it's not a forever fix.
Right.
But it's a relatively quick and painless way to address a number of issues.
Exactly.
Okay.
And it's important to remember that composite bonding isn't the right solution for every dental problem.
Right.
Like if you have severe decay or significant misalignment, other options might be more appropriate.
Makes sense. So it sounds like a good option for those seeking a less invasive and more affordable fix.
Yeah.
For minor to moderate dental concerns.
Exactly.
And speaking of affordability, I know everyone's probably wondering about the cost.
Yeah.
What's the typical price range for composite bonding?
You bring up a crucial point. The cost can vary depending on several factors.
Yeah. Yeah.
Like the complexity of the case, a dentist's expertise.
Right.
But on average, you can expect to pay somewhere between $300 and $600 per tooth.
Okay, so that's actually pretty reasonable, especially considering it's a cosmetic procedure.
Yeah.
But what about insurance? Does that usually cover composite bonding?
Unfortunately, most insurance plans only cover composite bonding if it's for restorative purposes,
Okay.
like repairing a chipped tooth caused by an injury.
Right.
If it's purely cosmetic, it's typically not covered, but it's always a good idea to check with your insurance provider just in case.
Yeah, always good to double check.
Mm-hmm.
All right, so we've covered what composite bonding is, how it works, and even touched on the cost and insurance.
We have.
But what someone's listening to this and thinking, bonding sounds great, but I'm curious about other options.
Sure.
What are the alternatives to composite bonding, and when might a dentist recommend them over bonding?
That's an excellent question and a perfect transition into our next segment.
Oh, perfect.
There are two other common options that people often consider:
Okay.
porcelain veneers and dental crowns.
Okay.
Each has its own unique advantages and disadvantages,
Uh-huh.
and sometimes they might be a better fit than composite bonding.
Right.
Let's dive into those now.
Sounds good. I'm curious to learn more about those alternatives. Let's take a deeper look. All right, so we're back, and I'm ready to dive into the world of veneers and crowns.
Okay.
I've heard these terms thrown around,
Yep.
but I'm a little fuzzy on the details.
Sure?
Can you help us understand what each of these procedures actually involves?
Absolutely. Let's start with veneers.
Okay.
Imagine them as these thin, custom-made shells that are bonded to the front surface of your teeth.
Okay.
They're usually made from porcelain,
Uh-huh.
which is known for its durability and stain resistance.
Right.
Veneers can address a wide range of cosmetic concerns,
Yeah.
like discoloration, chips, gaps, even minor misalignment.
So they're like a more permanent and aesthetically pleasing solution compared to bonding.
Yeah, that's a good way to put it. They offer a longer lifespan and better stain resistance than composite bonding.
Okay.
But there's a trade-off.
Uh-oh, what's that?
The procedure itself is a bit more invasive.
Oh, okay.
To make room for the veneers, the dentist needs to remove a thin layer of enamel from your teeth.
Got it. So that's a key difference.
Yeah.
Veneers require some enamel removal, whereas bonding doesn't.
Exactly.
What about the cost? Are veneers significantly more expensive than bonding?
They are, yes.
Oh, okay.
Because veneers are custom-made and require more lab work, the cost can be considerably higher.
I see.
You're looking at a price range of about $900 to $2,500 per tooth,
Wow. Okay.
depending on the dentist's fees and the complexity of the case.
Okay, so that's a pretty big jump from the $300 to $600 range for bonding.
Yeah,
So veneers are definitely a bigger investment.
they are.
Now let's talk about crowns.
Okay.
I remember you mentioned that crowns are the most durable option,
Yes,
but also the most invasive.
that's true.
Can you explain what makes crowns so different from veneers and bonding?
Sure. Unlike veneers, which only cover the front surface of a tooth,
Uh-huh.
a crown completely encases the entire visible portion of the tooth.
Wow.
It's like a cap that's custom fit to your tooth.
Okay.
Offering that maximum protection and strength, crowns are usually made from porcelain, ceramic, or metal.
Okay.
And they're typically used when a tooth is severely damaged, decayed, or has undergone a root canal.
So if a tooth is structurally compromised,
Yes,
a crown is the go-to solution.
exactly. It provides the most support and protection for a weakened tooth.
Okay.
And they're incredibly durable, lasting anywhere from 10 to 15 years or even longer with proper care.
Wow, that's impressive longevity.
It is.
But I imagine that durability comes at a price,
Yes,
both literally and figuratively.
you are right.
What's the cost comparison between crowns and the other options?
Crowns are the most expensive option out of the three.
Oh, wow.
The cost can range from about $1,000 to $3,500 per tooth.
Okay.
Again, depending on the materials, use the complexity of the case and the dentist's fees.
So if you're looking for the most durable and long-lasting solution, crowns are the way to go.
Yes,
But they do come with a higher price tag.
they do.
What about the invasiveness of the procedure?
Sure.
You mentioned that crowns require more tooth preparation than
Yes.
veneers or bonding.
That's right, because a crown covers the entire tooth. The dentist needs to remove a significant portion of the natural tooth structure
Oh, wow.
to make space for it.
I see.
It's the most invasive of the three procedures we've discussed.
Okay, so it's helpful to think of these options on a spectrum.
Yeah.
Bonding is the least invasive and most affordable.
Mm-hmm.
Veneers fall somewhere in the middle.
Yeah.
And crowns are the most durable,
Okay.
but also the most invasive and expensive.
Exactly.
Each option has its own set of pros and cons.
Exactly. There's no one-size-fits-all answer.
Right.
The best choice really depends on your individual needs, the condition of your teeth, budget, and your aesthetic goals.
That's a lot to consider.
It is.
And that's why it's so important to have a thorough consultation with a dentist
Yes.
before making any decisions. I completely agree. A dentist can evaluate your specific situation,
Mm-hmm.
discuss the pros and cons of each option,
Yeah,
and help you weigh the factors that matter most to you.
absolutely. They can also address any concerns you might have and answer questions about the procedures,
Right.
the materials used, and the expected outcomes.
So for anyone listening who's thinking, okay, this is all really interesting,
Yeah,
but how do I actually go about choosing the right option for me?
sure.
What advice would you give them? Where do they even begin?
The first step is to schedule a consultation with a dentist you trust.
Okay.
Be open and honest about your goals and expectations.
Okay.
What are you hoping to achieve?
Right.
Are you primarily concerned with aesthetics, or are there functional issues you want to address?
Uh-huh.
Do you have any budget constraints?
I see.
The more information you share with your dentist, the better equipped they'll be to guide you toward the best solution.
That makes a lot of sense. It's all about having an open and collaborative conversation with your dentist.
It is.
They're the experts after all.
Precisely. And don't be afraid to ask questions.
Right.
Your dentist should be willing to explain everything clearly and thoroughly so you feel comfortable and confident with the chosen treatment plan.
Right. It's a smile after all, so you should be involved in the decision-making process.
Absolutely.
Now let's shift gears for a moment
Okay.
and talk about life after these procedures.
Right.
We've discussed the procedures themselves.
I have.
But what about aftercare?
Sure.
Are there any special precautions people need to take regardless of which option they choose?
That's an important point to address.
Mm-hmm.
While each procedure has its own specific post-treatment instructions,
Okay.
there are some general guidelines that apply across the board.
Okay, good.
Good oral hygiene is crucial no matter what.
Of course.
That means brushing twice a day with a fluoride toothpaste,
Uh-huh.
flossing daily, and using mouthwash.
Right.
Regular dental checkups are also essential to monitor the condition of your teeth
Yeah.
and ensure everything is healing properly.
Okay, that sounds pretty standard.
Yeah.
But are there any specific things people should avoid doing after these procedures?
Um,
For example, I've heard that you need to be careful about biting into hard foods after getting veneers or crowns.
yes.
Is that true?
Yes, that's good advice.
Okay.
After any of these procedures, it's best to avoid biting into extremely hard or sticky foods,
Okay.
especially in the first few days or weeks while you're still healing.
Makes sense.
You don't want to risk damaging the newly restored teeth.
So no chomping on ice or trying to open packages with your teeth?
Exactly. Use scissors for that.
Good point.
And it's also wise to avoid habits like nail biting or chewing on pens,
Yeah.
as these can put stress on your teeth and potentially damage the restorations.
Good reminders. So it's basically about being mindful of your teeth
It is.
and treating them with care, especially after you've invested in these procedures.
That's right. It's an investment in your smile and your overall oral health.
Yeah.
So it's important to protect that investment with proper aftercare.
This has been incredibly informative.
Okay.
I feel like I've learned so much about composite bonding, veneers, crowns, and the factors to consider when making these decisions.
Good.
But before we wrap up, I want to touch on one more topic that I know is on everyone's mind, on longevity.
Sure.
We briefly mentioned the lifespan of each procedure.
Right.
But I'm curious to dig a little deeper.
Okay.
What are some of the factors that can affect how long these restorations last?
That's a great question. Longevity depends on several factors,
Okay.
some of which are within your control and some of which are not.
Uh-huh.
Let's start with the things you can control.
Okay, give us the insider tips for making these restorations last as long as possible. What can we do on our end?
As we've already discussed, good oral hygiene is paramount.
Right, so the basics are still the most important. What else can we do?
Being mindful of your diet also plays a role.
Okay,
Try to limit sugary and acidic foods and drinks,
okay.
as these can erode enamel and weaken the bond between the restoration and your tooth.
So maybe hold off on the daily soda habit.
That's probably wise.
Okay.
And if you grind your teeth at night, talk to your dentist about getting a mouth guard.
Uh-huh.
Grinding can put a lot of stress on your teeth, and it can even damage restorations over time.
Good point. So those are the things we can control.
Yes.
What about the factors that are beyond our control?
Well, the quality of the materials used and the dentist's skill and experience definitely play a role.
Right, it's like anything else, quality matters. Anything else we should be aware of.
The location of the restoration can also affect its lifespan.
Really?
Restorations on back teeth, which endure more chewing force,
Uh-huh.
might not last as long as those on front teeth.
That makes sense.
And of course, accidents happen.
Right.
If you chip or damage a tooth, it could affect the longevity of the restoration.
That's true. You can't always predict life's little mishaps.
Right.
But it sounds like overall there's a lot we can do to help these restorations last as long as possible.
Absolutely. By taking good care of your teeth, being mindful with your habits, and choosing a skilled dentist, you can maximize the lifespan of your restorations and enjoy a healthy, beautiful smile for years to come.
Well said. This has been such an illuminating conversation. We've covered so much ground from the basics of each procedure
Yeah.
to the nuances of aftercare and longevity. I feel like I have a much deeper understanding of the options available
Mm,
and the factors to consider when making these decisions.
I'm glad to hear that.
Yeah,
Remember, knowledge is power when it comes to your health, including your dental health.
absolutely. And speaking of knowledge, we're going to take a quick break, but when we come back, we'll wrap up our deep dive into composite dental bonding.
Okay.
With some final thoughts and key takeaways, stay tuned. Welcome back to the deep dive. As we wrap up our exploration of composite dental bonding, I'm struck by how much there is to consider when it comes to our smiles.
I know it's true. We often think of dentistry as purely functional.
Yeah.
But as we've seen with composite bonding, it can be just as much about aesthetics.
Exactly. It's like finding that sweet spot where health and beauty intersect.
Mhm.
But with so many options available, it can be tough to know where to even start.
Yeah, it can.
What advice would you give to someone who's listening to this and feeling overwhelmed by all this information?
Well, I'd say the most important thing is to remember that you're not alone in this process.
That's true.
Your dentist is there to guide you every step of the way.
They are. That's such a good point. They're not just there to, drill and fill.
No.
They're partners in helping you achieve your smile goals.
Absolutely. So don't be shy about asking questions, voicing your concerns, and really understanding the pros and cons of each option.
Okay, so step one is finding a dentist you trust and having an open and honest conversation with them.
Yes.
What else should people keep in mind as they navigate this decision-making process?
I think it's helpful to go into that consultation with a clear understanding of your priorities.
Okay.
What are your must-haves, and what are you willing to compromise on?
Right.
Are you primarily concerned with cost, longevity, aesthetics, or maybe a combination of factors?
Right, because those priorities will really shape the conversation and help narrow down the options.
Exactly.
Now, for those who are specifically interested in composite bonding,
Sure.
what are some key takeaways that they should remember?
Well, first and foremost, composite bonding is a versatile procedure that can address a variety of both cosmetic and functional concerns.
Okay.
It's a minimally invasive option that could be completed relatively quickly and affordably.
It's like the quick fix for a brighter, more confident smile.
Exactly.
Love it.
But it's important to be aware of its limitations as well.
Right.
Composite bonding isn't as durable or as stain-resistant as some of the alternatives,
Right.
and it might not be suitable for addressing severe dental issues.
Right. So it's not a magic solution for every dental problem.
No, it's not.
It's all about finding the right tool for the job.
Precisely. And that's where that conversation with your dentist becomes so crucial.
Mm-hmm.
They can help determine if composite bonding is the right fit for your needs and guide you towards the best solution for your unique situation.
I love that you keep emphasizing the importance of that dentist-patient relationship.
It's important.
It's not just about the procedure itself. It's about having that trusted advisor to help you make these informed decisions about your oral health.
Couldn't agree more. Dentistry is a collaborative process.
Yeah.
And your dentist should be your partner in achieving a healthy, beautiful smile.
Well said. As we wrap up this deep dive, I want to leave our listeners with one final thought.
Okay.
Given everything that we discussed today, what factors would you personally weigh most heavily when deciding between composite bonding and its alternatives?
That's a great question. For me, it would come down to a balance of longevity aesthetics and invasiveness.
Okay.
I'd want a solution that looks natural, lasts for a reasonable amount of time, and doesn't require removing too much of my natural tooth structure.
Yeah, that makes a lot of sense. It's about finding that sweet spot where all those factors align with your personal preferences and values.
Exactly. And remember, there's no right or wrong answer.
Yeah.
The best choice is the one that feels right for you.
Right.
And that's a decision you should make in consultation with your dentist.
Couldn't have said it better myself. Well, folks, there you have it.
We did it.
We've explored the ins and outs of composite dental bonding, compared it to its alternatives, and armed you with the knowledge to have a productive conversation with your dentist.
We have.
So it's been a pleasure joining you on this journey of dental discovery.
The pleasure was all mine.
And thank you for joining us on the Deep Dive. We'll catch you next time for another fascinating exploration.
See you then.
Until then, keep those pearly whites shining bright.